Spending time in the hospital is bad enough. Even worse, though, hospitals have become breeding grounds for drug-resistant bacteria that infect and often kill patients. And in New Mexico, if you try to find out which hospitals have the worst infection problems, you may be out of luck. On tonight's special assignment, Tim Maestas reports on a new push to make that information public.
You go to the hospital to get better, not to get sicker.
Is that what's happening in a lot of cases?
That is happening in some cases.
Hospital-associated infections, a long list of potentially fatal illnesses that unexpectedly affect patients receiving treatment for other things. With names like MRSA and C. diff, they're among the top 10 causes of death in the United States.
Pathogens or certain infectious agents can pass from one person, one thing to another.
Even though the infections are so common and so dangerous, there is no law currently in place requiring New Mexico hospitals to publicly report if someone catches an infection while undergoing treatment. But state health officials and some hospitals are trying to change that.
I think it's a culture change within healthcare that we no longer take it for granted that patients have to be put at risk.
For 2 years, state health officials have been tracking two things: healthcare worker flu vaccination rates and a potential complication that can arise from installing IV lines in major veins and arteries. Those types of complications kill up to 24% of the time.
Bacteria do like to colonize plastic, and if the insertion and the care of the catheter is not meticulous, it will become colonized with bacteria.
Many of these can be avoided.
Dr. Joan Bomback is behind the effort to track hospital infections for the state health department and ultimately prevent them.
I think we have recognized as a state and as well as a country how important the problem is.
Even so, hospitals are not required to participate in the program. Right now, 28 of the state's 45 hospitals are submitting data to the state. The goal is to eventually require New Mexico hospitals to report the information.
We think having mandatory reporting would be good for New Mexico for a number of reasons.
Dr. Bomback says requiring hospitals to report their infection rates would set standards, level the playing field, and provide legal protections for both patients and healthcare facilities providing the numbers.
There's great evidence out there about how to prevent infections, and that's what has to be understood and adhered to.
Data collected from New Mexico hospitals goes into a national database to compare with other hospitals across the country. Among those taking part, UNM and Loveless hospitals.
It prompts us to do things differently. That's the whole quality process, looking at how you do things, making it better.
Turns out simple things like consistent hand washing can play a major role in protecting patients from preventable infections.
We want to see everybody doing hand hygiene before they go into a room and after they come out, even if they swear that they didn't touch anything. We still want to see that.
UNM hospital epidemiologist Susan Kelly says her hospital is taking serious measures to ensure healthcare workers do everything to avoid preventable infections. She says attitudes are evolving.
Screening patients for MRSA, for instance, methicillin-resistant Staph aureus, a few years ago, we just took it for granted that these things happened.
Even if the law does not change, Dr. Bomback sees more New Mexico hospitals reporting their data in the future.
We've gone from half a dozen during the pilot to more than 4 times that now, which has been working out very well, and we think over time nearly the entire state will be involved.
Tim Maestas, KRQE News 13.
27 states currently do require public reporting of hospital-acquired infection rates. Beginning January 1st, hospitals in all states will be required to submit their infection data, or they could lose federal money. Eventually, those infection rates will be posted on the national website Hospital Compare. In the meantime, some hospitals, like UNMH, do voluntarily post their infection rates on their own websites.